Liver. Liver is a vital organ responsible for numerous functions in the body, including metabolism, detoxification, storage of nutrients, and production of proteins. Today, we're going to talk about two very important liver tests. The first one is called liver function test. Liver function tests are a group of blood tests that measure specific enzymes, proteins, and other substances produced by the liver. The second one is called test of liver injury. Test of liver injury typically involve assessing specific liver enzymes and biomarkers in the blood to evaluate the extent of the liver damage or dysfunction. So let's talk about LFT. What is LFT? LFT is a short form for liver function test. So when you're doing a liver function test, you need to check three important substances or proteins. The first one is called prothrombin time. The second one is called serum albumin. The third one is called serum direct bilirubin. All right. Since we are still talking about LFT, the first one we need to do is prothrombin time. What if prothrombin time, you check it and it's high? If it is increased, it means there is hepatocellular dysfunction or vitamin K deficiency. How we can differentiate? Note, if you administer vitamin K and it will correct the PT and INR, it is vitamin K deficiency. If vitamin K is normal, but PT and INR is high, it is due to hepatocellular dysfunction, not vitamin K deficiency. All right, let's talk about the second protein in liver function test, serum albumin. If serum albumin is high, it means there might be hepatocellular dysfunction. There might be another cause, which is very important, malnutrition. There's another cause, which is renal or GI loss, like diarrhea and so on and so forth. Inflammation, if there's a very severe or significant inflammation, albumin will go high. And the last but not least, malignancy. If there is a malignancy going on, serum albumin will go high. The third substance or protein is serum direct bilirubin. If it is high or increased, it means there is a liver dysfunction. It means your liver is not working properly. But remember, conjugation is preserved even in the last or end stage liver failure. That's a good thing about conjugation. Let's talk about the second test, which is called test of the liver injuries. If you're suspected for liver injury, what do you check? Liver enzymes. What are the liver enzymes? We have two very important liver enzymes. The first one is called ALT, and the second one is AST, that I will talk about them in details in the next slide. The second one is alkaline phosphatase, and the third one is GGT. As promised, let's talk about ALT and AST. Liver enzymes, ALT and AST. ALT is more specific to the liver. It means if it is high, it's most commonly inside the liver. AST is also from the liver, but it has multiple sources, especially muscle. So if both ALT and AST are high or increased, it shows liver injury. If AST is more than ALT, like twice as much, like for example, AST is 200, ALT is 100, it means the liver injury is caused by alcohol, which is called alcoholic liver injury. But if ALT is more than AST or twice as AST, for example, ALT is 180 and AST is 90, it means that the damage is not caused by alcohol. It might be fatty liver. Most cases, ALT will be more than ALT. If ALT and AST is more than 1000, it means your liver is in danger. It's not working properly. There might be a lot of issues with the liver that I'm going to get into them right now. If ALT and AST is more than 1000, what does it mean? It means the patient may overdose with a prescription medication, with an OTC or over-the-counter medication, or with a toxin. So it means the patient used too much drug or toxin that causes ALT and AST to go over 1000. The second cause could be virus, like viral hepatitis. Viral hepatitis cause ALT and AST more than 1000. Autoimmune hepatitis, which platelet will be less than 100,000. The last but not least, hepatic ischemia or hepatic infarction. ALT and AST will be more than 1000. Okay, let's talk about alkaline phosphatase. Alkaline phosphatase and GGT will be increased in cholestasis. If alkaline phosphatase alone increased, please rule out bone diseases, because if it is by itself high, so there might be bone disease like Paget disease. If alkaline phosphatase is out of proportion to ALT and AST, it means it's very high. There might be three main causes. The first one is common bile duct obstruction. That's common bile duct. The second one is pancreatic cancer. Pancreatic cancer, let me show you the pancreatic cancer. Where does it located? Right here. And the last but not least, cholangiocarcinoma. Let me show you the cancer. The cancer is located right here, cholangiocarcinoma. So if ALT is very high, then think about these three health issues. Okay, GGT. Usually it increases in alcoholic liver injuries. Anyone who is over drinking alcoholic beverage, so it will be high. Dr. MNJ key points, very, very important. Remember that. You will definitely get a case and question. If there is a liver injury and your patient is drinking alcohol, or he has a long history of alcohol, AST will be twice as much as ALT, and also GGT will be high. But if there is a liver injury, but your patient is not drinking alcohol, but your patient is overweight, in that case, ALT will be high. Let me draw some fast food. So you have an overweight patient using a lot of fast food, so ALT will be more than AST. That's a key point, remember. AST is short form for aspartate aminotransferase. ALT is short form for alanine transaminase. GGT is short form for gamma glutamyl transferase. INR is short form for international normalized ratio, and GI gastrointestinal. Note, remember, if there is an acute liver failure, you might have three things to look for. ALT and AST might be more than 1000. Second, there might be hepatic encephalopathy, positive or present. Third, INR will be more than 1.5. Thank you very much for watching and staying with me for so far. I hope you find this lecture fruitful. This video is designed and prepared by me, Dr. Muhammad Nasir Jola. The main goal for this educational video is to provide some medical information for Afghan female medical students and doctors, healthcare workers who are deprived from their basic right, which is studying and saving lives. Thank you very much. This information has been taken from very reliable sources like Toronto Notes and USMLE. Toronto Notes is a reliable source for Canada, and UWorld USMLE is